So as you know, we always like to have people on the show agree, disagree. We like to get into good discussions. And the guy we have this on the line right now, certainly he is not a fan of Dr. Fauci. I think that's very fair. Stretch. I don't think that's a stretch. I think he would agree. His name is Dr. David Samadi. He is a urology expert, robotic surgeon, the director of men's health at St. Francis Hospital, and a former Fox News medical expert. We appreciate the doctor taking some time to join us. Dr. Samadi, thank you so much for being here. How are you?
Thanks a lot, doctor.
Doing great. Thank you for having me. I appreciate the time.
Yeah, appreciate
Absolutely.
you. All right, so let me start, but let's talk about Dr. Fauci. You've been one of those people that have been very outspoken against Dr. Fauci. Is that fair to say?
Well, I'm trying to keep it very professional. And if you see on all of my tweets, I always say that it's nothing personal. As a physician, from one colleague to another, you don't want to criticize someone. But I think this is a very important time in this country. This is a time where millions of Americans have lost their jobs. They're looking for direction. The president has done what he has to do. As someone that has been able to bring the private and the public sector, be able to bring in whatever we needed, from medications to clinical trials to ventilators, he did what he had to do. But then he has to be able to count on some public health physicians, advisors that do the right thing. And the problem with Dr. Fauci is, even though he's extremely well known in his field, you cannot play on both sides. When I got excited was when he said, I told you in February or March, don't wear a mask because we didn't have enough for our doctors. Well, as a public health physician, you could have said, cover your mouth with whatever you want. This is the time that we need to have a mandate for masks, not when the death rate is all the way down, the curves are all coming down, and then it says now to mandate the mask. So there has been so many back and forth issues between CDC, him, and others, and that's when the public is starting to lose their trust and a lot of miscommunications. That's my beef. Otherwise, it's nothing personal.
Okay,
it's all
fair
about
enough.
American and American lives.
All right, I think we all would agree Dr. Fauci certainly is not perfect. He's made mistakes, as any scientist or doctor would make mistakes. But
Sure.
I guess this is a question for you, and I think it's a fair question. And I don't mean any disrespect by asking you this, but you're an expert in urology. You're a robotic surgeon. But correct me if I'm wrong. You're not an infectious disease expert. And again, I ask you this question with all due respect. Why should people listen to you when you're not an infectious disease expert and Dr. Fauci is?
That's because, number one, as a physician, we all have the knowledge base, and we're all able to read scientific data and articles and be able to analyze it and look at exactly what type of research was done. So every doctor out there who's gone through medical school and training is able to read and be able to have constructive criticism.
I don't doubt that.
I was on Fox News for about 10 years. We covered the host of thousands and thousands of different medical topics. And if you look at my record for the last many, many years, it's always been to help the public be able to give the accurate results. I've been very fortunate that I never got paid by any pharma, by any companies, never had any sponsors. And even when I was on Fox and now on Newsmax and OAN, I've never been under any pressure by anybody to say one thing versus another because I never get paid by anybody. And
Doctor, I appreciate that about you. And don't get me wrong, you're an extremely smart guy.
And it's good you're not compromised like that.
You're an extremely smart guy, and I don't doubt that about you. And I understand that when you go through med school, you have to, get information that we probably don't have, and you have more knowledge than me. All I'm simply saying is, and I think you would agree with where I'm going with this, there are infectious disease experts, and then there are not. That's all I'm trying to say. But let me ask.
Fine.
Yeah, but let me take it a step further. And you'd mentioned OAN, you'd mentioned Fox News, that you made appearances on Newsmax, and let's just call it for what it is. These are conservative stations, and there's nothing wrong with you making those appearances. I'm not criticizing you for it. However, here's where I'm going to give you a little bit of pullback, and we can talk a little bit about this. You've gone after Dr. Fauci, and you have the absolute right to do that, right? I go after Donald Trump every day because I don't like the things he says and some of the things he does. But I want to give you an example of something that I wish you would have been outspoken about, which is the president in a coronavirus press conference talking about injecting people with disinfectants. I went through your social media page, and again, I have no problem with you attacking or not making it personal, like you said, but criticizing Dr. Fauci. Why, when I look at your Twitter account, I don't see you criticizing the president for anything?
Listen, this is not, on my Twitter, I try to stay out of the politics and try to give as much of good medical information, data, and I try to stay out of the rhetorics, etc. At the time when President started to talk about like this Clorox and disinfections, right before he went on air, the head of CDC and others, they were talking about like a new study that came out whereby having like ultraviolet light inside the esophagus, it's possible that we would be able to kill this coronavirus in the nasal, in the throat, and also in the esophagus. Then the show goes live, and then there's a lot of like questions that comes from reporters. And you have to understand, these guys are super aggressive, and they're pushing him. All he said is that this is the time that we're talking about the virus, how long it would last on the surface. Remember that?
Yes, I do.
Whether we were going to get the virus from the surface or not, how long does it last? This is the time that, mainstream media was talking about the fact that if you get delivery food, you should, wash the bags. And that was the time. This is about a couple of months ago.
Right, I remember that, yeah.
And all he said was that, yes, you can use Clorox to, wipe all this stuff. But as a result of this study that they handed him right before he went to live, he said maybe there are things that we can do from inside out rather than outside in.
Can we agree that was
form of
but can we agree, doctor, and then we can move on, him even bringing that up in a coronavirus press conference about possibly injecting, that's the UC word, with disinfectants, was an idiotic thing for him to say and irresponsible. Is that fair to say?
I think he should just leave a lot of the science and medicine to the doctors and basically stick to a lot of the executive decisions as he did in the past. So I think that's a fair criticism, but not to take it to the point that, look, I don't expect him to know a lot about this scientific. He's counting on people like us and Dr. Fauci and others, and there are a lot of smart. That's what's great about this country, is that there's so many powerful minds in this country, and that's what he should count on. The big other criticism that you and I should be talking about is, why would we put the destiny of a whole entire country in the hands of like one or two or three experts in infectious disease? And this was a very good criticism that came from Rand Paul. This has nothing to do with being on the right or the left. The fight is the virus and pandemic and what came from China or wherever the source is, and to get back to our life. This is not, I'm happy to talk on CNN if they give me the platform, or MSNBC every day. It has nothing to do with right or left. It's about having a platform to give information to public. But I agree with you that at that point you should have left it to the doctors to come up with more innovation about the fight against the virus and stick to more executive decisions.
Right.
Doctor, another situation or drug that Donald Trump was speaking about was hydroxychloroquine for an extended period of time. And Dr. Fauci on multiple occasions said there was anecdotal evidence, it wasn't empirical. It doesn't. There's not enough evidence to say that it works. And then he recommended that doctors across the country not use it. And then a study came out from Henry Ford that showed that hydroxychloroquine, a decent-sized study, 2,000-plus patients, but it showed that hydroxychloroquine actually reduced the chance of death by about half. What do you now? And he's been pushing remdesivir as the standard of care. Remdesivir, as we know now, is about 300 times more expensive than hydroxychloroquine is. Do you think that Anthony Fauci is financially involved with either remdesivir or any of the vaccines like Moderna that's being created by Bill Gates' company?
I don't know. I don't know that answer, and I don't want to accuse anybody, and it's not my position to make comments like that.
Understood.
But what I will tell you is, let me tell you a little bit about hydroxychloroquine and where we stand with this. At the time when this pandemic started, we had no idea the transmission, whether it's from human to human, how aggressive it's going to be, who is going to be exposed to this. Is it going to be nursing home? Is it going to be younger ones? So we were completely shooting in the blind. When we started seeing these models, go back to January and February, where they came up with the models of 2 million body bags out there, 1 million dead people expected. And you remember that time when the Surgeon General came and said, this week is our Pearl Harbor, this is our 9/11 time, 240,000 dead bodies to be expected. So that's when the president, as a result of some of the articles that was coming out, said, what do we have to lose? If hydroxychloroquine is going to save one life, and there were people coming in, there was a Democratic politician that came and said, this saved my life. A lot of people came, said, this saved my life, etc. And now we know, based on a lot of studies, that hydroxychloroquine, when it's given at the early stage, before the inflammation starts to kick in, it may not work for everybody, but it can reduce inflammation, and perhaps not just that. You can also use, now we know, dexamethasone, steroids, steroid puffs, whatever it takes to reduce nebulizers, to open up your lungs, make sure you breathe, make sure the inflammation doesn't take over your system and doesn't get you to the point of getting closer to ventilator. Once you get to the ventilator, almost that's the finish line and you're almost done. So that's why he was pushing for it, because we were desperate. There was no real clinical trial, prospective, double-blind that would take 2 years. And Fauci is a real scientist. And there's absolutely, he needs to be commended for the fact that he wants real clinical trials, except that's when you're sitting at the comfort of your home. You have all the time you want. You run these clinical trials like the way he runs it at the Institute of Allergies and Infectious Disease. Those take years, and some of those may not pan out. But when you have an emergency and you're in charge of a country, he had to make an executive decision, and he said, look, this is what can be used.
All right.
In the late stage of the disease, that medication won't work.
All right,
in the early stage, zinc, Z-Pak, hydroxychloroquine, dexamethasone, and to some extent, remdesivir would reduce the viral load, and it can save lives.
I don't think there's any reasonable.
Sure.
I don't think there's any reasonable person out there that wouldn't agree that we should do whatever we can to try to save lives and help people. I have no problem with that. If you're just joining us, we're speaking with Dr. David Samadi, former Fox News medical expert, and been around for a while, and we appreciate his time. So let's go back to Dr. Fauci for a second, if we may, Doctor. So trade advisor Peter Navarro just tore into Fauci recently in an op-ed saying that Dr. Fauci has been wrong about everything. Now, we all agree that Dr. Fauci certainly has made some mistakes, but to say he's wrong about everything is not factually accurate. And let's remember that it was George W. Bush that gave Dr. Fauci the Presidential Medal of Freedom. This is a decent man. He's not perfect. He's made mistakes. You did go on Twitter and you said Navarro has the right to have an opinion on Dr. Fauci, as we all do. But don't you think it's just a little bit irresponsible for somebody in Donald Trump's administration, not saying that at times Dr. Fauci has been wrong, but to say he's been wrong about everything, which is just a flat-out lie?
I think we need to be respectful of each other. I think the country is extremely polarized. The problem is that people are really frustrated. I agree with you that there is a better way to handle the situation and not go after people's throat and criticize. I hope, and I am sure as a physician, he's trying to do everything he can in his power. There are things and there are mistakes. For example, all these interviews with Julia Roberts and all these nightly interviews with every possible, TV station could have been handled a little bit better and tone it down a little bit and let the administration be the messenger. You have Pence, the vice president, who's like the front line of this group. He doesn't need to put himself out there as a celebrity doctor. He needs to be more.
We need to hear from the experts.
Yeah. etc. But, you have to understand also, like CNN had him with, Sanjay Gupta every night talking about, things that were important for them, and they pushed him through this whole thing. So I understand where, Navarro is coming from, but to say that he was wrong about everything, I don't think that's fair. I think he tried to bring social distancing and try to help. We just have to. We can criticize. We can criticize anybody.
Sure, but
we need to be professional and respectful.
You don't. Okay, sure. Listen, I agree with everything you just said, except for one thing. What is your issue with Sanjay Gupta? He's an infectious disease expert. He's extremely intelligent. Whether he's on 5 times a day on CNN or once a month, what does it matter? So long as it's an expert talking about something in his expertise, why would you have an issue with that?
Sanjay Gupta is not an infectious disease doctor. He's a neurosurgeon, and he's a colleague of mine, and I respect him. What I'm saying is that if he was going to give the news, it was the public thought that he was more leaning to just make himself more popular as opposed to giving good information out to public. I certainly think that a lot of these task interviews that they did during the task force was very helpful. It was informative. But, they wanted the results. And the idea of, for example, one of the things that's bothersome is that we have a lot of data about children. and the fact that we need to open up our schools. The data shows that the risk of children dying from this virus is very low. Where is Dr. Fauci coming and give some positive news to the public, saying I feel comfortable as the expert, as your leading doctor in the country. It's safe to open up the schools. We can protect our teachers and get the economy going. This is the expectation from someone at a leading position where he's sitting over here, and yet he's always playing both sides. Maybe, perhaps, it's always the cup half empty, and that's a frustration, I think.
But when you say about schools reopening, I think there would be a lot of people that might disagree with you on that. And the reason for that is, as you know, Doctor, there are hot spots throughout the country and some states that are actually stopping the reopening of certain businesses, and they're pulling back. You know exactly what's happening in Florida. We have a governor there in Florida who refuses to even give out the hospitalization details. We know why he's doing that, because he doesn't want people to find out about it. You look at what's happening.
Now, what about what's happening in Orlando, where they were reporting 98% positive cases, and the actual numbers were 9.4% in Florida?
But the fact still remains the same, with my opinion, in that there are hot spots throughout the country. There are issues throughout the country right now with the coronavirus and the uptick in cases. Yes, you can say, well, the death rate is down. But as you know, Doctor, more than anybody, it takes a little bit of time, sadly, for some of these people to lose their lives. And I wish that wasn't the case. So can it just be a situation?
Let me stop you for a minute, because the death rate has been going down for the last almost 6-7 weeks. And it doesn't take that long for these numbers to come back. The good news is that we have been very good in treating these patients. We're catching them early. We're taking care of these patients. And that's a good news for America. This is a big win for us. We're finally getting the damn thing under control.
You think so?
To take care of, yes.
You think we're getting this under control?
Nursing home, all the mistakes, that's right. All the mistakes that was made in New York, other states are not making. The numbers are on the rise because for many reasons. One is that we opened up our economy. A lot of people went out there. They were a little careless, so they ended up getting the virus. The second thing is that we're doing massive testing, and you're going to find them. The third reason is because we opened up our hospitals, and there are hundreds of thousands of cases that's going for elective surgery. Every one of those patients, they have to get tested for COVID, and we're finding them there.
No, I get that.
A lot of so all of that is adding up to the numbers. Those numbers, by the way, are not the reason to go back in lockdown. This whole narrative about the lockdown is being manipulated by these governors, because the lockdown was to give us some time for the hospitals to catch up. It wasn't.
The hospitals are not caught up, but as you know, sir, there are hospitals throughout the country that are not caught up. Their ICU units are full to capacity. Look at what's going on in Arizona.
I appreciate what you're saying, but the ICUs and the hospitals are supposed to be full. This is a business. The hospital never keeps the ICUs at a low number. What I'm asking you to do is to go back to those hospitals that you're talking about and find out what % of those ICU and what % of those beds
are COVID.
Are COVID, and
right.
Please call me back next week. I would love to do another interview with you. Just randomly to say the numbers are up and the whole world is on fire.
No, I'm not saying the whole world. No, as you know, the whole world is not on fire. The United States is on fire.
Hey, Dr. Samadi,
it's not.
You look at
that's a part of the problem with the media, is they make excitement and panic.
Okay, let me respond to him.
And these numbers.
Let me respond to you.
But it doesn't take away from the fact. It still doesn't take away the fact that the children are safe. They don't die from this disease. They don't transmit this to adults.
Okay, but we're not talking about just children now. I get that, sir, and I respect, and I want JD to chime in here, but I have to say this.
Don't go to nursing home and visit.
The world is not on fire, but we have a fourth of more actually than a fourth of all the cases in the world. You don't find that to be a little bit problematic, that we have in the richest country in the world, we have a fourth of the cases?
It's a huge country. This country is, you look at Italy as this one country, but that's only one of our states. We have 50 states. It's a huge country. The numbers are up. Our numbers will continue to go up, but pay attention to the death rate. If we can control people from dying, then we're in good shape.
We have 136,000 deaths.
Speaking of the death rate, Dr. Samadi, you look at...
If you don't mind, let me just make...
sure.
I apologize for...
No problem.
47% of those numbers you're talking about is from the nursing.
That's right.
Are you talking about the fact that, the president opened 3,000 beds in Javits Center and 1,000 beds on that ship, and we never used hardly ever any of those beds, and we put sick people back into the nursing home. We made a lot of mistakes, and that's why
I have no doubt that
are a problem. By the way,
no doubt.
By the way, you forgot to mention that some of those patients died from a different disease, and they listed as COVID. The guy goes in for a massive heart attack, and on the way to like dying, they test him for COVID, happens to be positive COVID, and on the death certificate, it's also listed
All right,
as COVID.
so let's
positive.
assume
In
that,
a big pandemic
I hear you.
where millions of people can anyway.
I hear you.
Sorry, go ahead.
But again, if the 136,000 deaths, let's just say there was really only 100,000 deaths, we have over 3.4.
Nothing to be proud of.
No, it's not.
Nothing to be,
Exactly.
It would have been great if it was only
Well,
one
yeah,
person.
but you also have to take a look at the flu deaths, Brian, and those are down significantly. So
Well,
are
I'm not comparing-
strokes, heart attacks. I mean, you look at the actual numbers of dead, and I talked about this with Doug Basham, but since February 1st, the percentage of total deaths in the United States is only 105%. We're up 5% in collective deaths. And when you talk about what happened with the nursing homes in New York and New Jersey and Massachusetts and Michigan, if you look at the actual, and this is a question for you, Dr. Samadi, but you look at the mortality rates in Democratic governed states versus Republican governed states, I mean, there's nearly almost a 200% difference. Why do you think that is, Doctor?
Well, I think the management was wrong. I think they're overreacting to every little detail. That the numbers go up. So what? Why are you locking down? For example, what are we doing in California? What's the point of or Arizona? Why are we locking down the countries? The numbers are going to go up. Who said that the lockdown is going to cure this virus? Who came up with this narrative that by locking down the country and closing it down again,
dozens of other
this virus
countries,
will go
dozens.
away?
Well, I'll tell you who said dozens of other countries around the world, and that's why they're in a better situation than we're in, sir. With all due respect.
No, the lockdown.
What do you mean no?
doesn't
Then
cure
why?
the
Then why do we have a
virus. When you
bigger
reopen
problem?
The economy.
Well, then what's your explanation? Why do all these other countries around the world are in a much better position than we're in? What's your explanation for that?
I don't think Italy is any better.
I didn't say
position.
Italy, but
Spain was in any position.
I understand.
I don't think a lot of European countries are in any other position.
Most of the world is in a much better position than we're in because they closed down the economy and they closed down earlier.
I don't think the lockdown is going to help the virus to go away. When you open it up again, you're going to like deal with this virus. This virus is going to be around for a while. It may mutate. Usually, when the mutation happens, it's to a lower strength, not a higher one. But the bottom line is, as we continue to do more testing, as we continue to find more patients, the key is to protect the elderly. This is a target. This is now a visible enemy, not invisible. As long as we protect our elderly with multiple medical issues, I think we will be in good shape.
Understood.
The
Doctor,
work that Dr. Fauci has done, we need to take it, and whatever I think he's given his best, we need to use that as a foundation and build up on
I
it
agree.
to save the public.
Well, that's where we agree 100%. Well, Doctor,
we need to stick together as a Democrat and Republican and put all the political garbage to the side.
I agree.
This country.
I agree.
The enemy is not here.
I agree.
The enemy is outside.
Doctor,
why don't we figure out how this virus
Sure. Doctor, I could not agree with you more with what you just said. I'm going to take you up on that offer. We would love to have you on again. I think this is a great conversation. Doesn't mean we're going to agree on everything, but I do appreciate you taking some time to join us, and I would love to have this.
I appreciate you.
Sure.
Thank you very much.
Thank you for your time,
thanks a lot,
Doctor. We appreciate Dr. David Samadi. Good conversation.